Physiological Needs Nursing Foundation Study Guide. Question 1. A client with shortness of breath is sitting upright and using accessory muscles. Which need is the priority? Option A, oxygenation. Option B, nutrition. Option C, elimination. Option D, sleep. The correct answer is option A, oxygenation. Oxygen is the body's first currency. Without it, every organ begins to run on borrowed time, so breathing needs rise above all others. Question 2. A nurse cares for a dehydrated client with dry mucous membranes and poor skin turgor. Which intervention is most appropriate if prescribed? Option A, encourage or administer fluids as ordered. Option B, restrict all oral intake. Option C, increase room temperature. Option D, delay intake until next shift. The correct answer is option A, encourage or administer fluids as ordered. Fluid restores the river that carries oxygen, nutrients, and waste. Rehydration supports circulation before small deficits become large dangers. Question 3. A client is constipated after surgery. Which nursing action is best? Option A, encourage ambulation and fluids if allowed. Option B, tell the client not to report it. Option C, limit fiber forever. Option D, provide privacy only after several days. The correct answer is option A, encourage ambulation and fluids if allowed. Bowels move better when the body moves and fluid softens the path. Mobility and hydration help the gut wake up after surgery. Question 4. A client with dysphagia is eating lunch. Which finding requires immediate action? Option A, coughing during swallowing. Option B, eating slowly. Option C, taking small bites. Option D, sitting upright. The correct answer is option A, coughing during swallowing. Coughing during meals can signal food near the airway. The nurse acts quickly because aspiration can turn a meal into a breathing emergency. Question 5. A nurse is caring for a client with a pressure injury risk. Which need is directly supported by turning every 2 hours? Option A, tissue integrity. Option B, spiritual growth. Option C, role development. Option D, financial security. The correct answer is option A, tissue integrity. Turning relieves pressure so blood can nourish skin. It is like moving a heavy stone before the grass beneath it dies. Question 6. A client reports pain rated 9 out of 10. Which nursing action is most appropriate? Option A, assess pain characteristics and administer prescribed relief. Option B, ignore pain until vital signs change. Option C, tell the client pain is expected. Option D, wait for family to arrive. The correct answer is option A, assess pain characteristics and administer prescribed relief. Pain is both symptom and stressor. Assessing and treating it protects healing, mobility, breathing, and trust. Question 7. A client with vomiting is at risk for which physiological imbalance? Option A, fluid and electrolyte disturbance. Option B, improved calcium storage. Option C, increased oxygen capacity. Option D, excess tissue growth. The correct answer is option A, fluid and electrolyte disturbance. Vomiting drains the body's chemistry as well as its water. Electrolyte shifts can disturb muscles, nerves, and the heart. Question 8. A nurse is prioritizing care for 4 clients. Which client should be seen first? Option A, client with new chest pain and sweating. Option B, client requesting a bath. Option C, client waiting for discharge teaching. Option D, client asking for television help. The correct answer is option A, client with new chest pain and sweating. New chest pain is a flashing warning light for circulation. Physiological threats outrank comfort, teaching, and routine requests. Question 9. A client with limited mobility needs nutritional support for wound healing. Which food choice is best? Option A, protein-rich meal is tolerated. Option B, only clear soda. Option C, low-calorie candy. Option D, plain tea only. The correct answer is option A, protein-rich meal is tolerated. Protein supplies the building blocks for repair. Wound healing is construction work, and the body cannot rebuild with empty materials. Question 10. A nurse notes crackles in the lungs of a client receiving 4 fluids. What should the nurse do? Option A, assess further and report possible fluid overload. Option B, increase flow rate immediately. Option C, place client flat. Option D, encourage more oral fluids. The correct answer is option A, assess further and report possible fluid overload. Crackles may mean fluid is backing into the lungs. The nurse listens to the warning before the breath becomes flooded. Question 11. A client cannot sleep because of frequent nighttime vital signs. Which action supports rest while maintaining safety? Option A, cluster care when clinically appropriate. Option B, wake the client every 15 minutes routinely. Option C, turn on bright lights all night. Option D, delay all assessments until morning. The correct answer is option A, cluster care when clinically appropriate. Rest is not a luxury, it is repair time. Clustering care protects sleep while still honoring clinical monitoring. Question 12. A client with diarrhea is at highest risk for which complication? Option A, dehydration. Option B, improved skin integrity. Option C, excess sleep. Option D, increased appetite. The correct answer is option A, dehydration. Diarrhea can empty the body's water tank quickly. Older adults and weak clients may decline before the loss looks dramatic. Question 13. A client receiving oxygen by nasal cannula has dry nares. Which action is appropriate? Option A, assess oxygen setup and provide ordered humidification if indicated. Option B, remove oxygen without checking saturation. Option C, apply petroleum jelly inside the nose. Option D, increase flow without an order. The correct answer is option A, assess oxygen setup and provide ordered humidification if indicated. Comfort and safety travel together. Dry mucosa can crack, and oxygen equipment should be checked before changes are made. Question 14. A nurse evaluates intake and output for a client with heart failure. Why is this important? Option A, it reflects fluid balance and workload on the heart. Option B, it replaces lung assessment. Option C, it measures only nutrition. Option D, it predicts personality changes. The correct answer is option A, it reflects fluid balance and workload on the heart. Fluid balance speaks the language of the heart. Too much volume can make the pump struggle and the lungs complain. Question 15. A client is NPO before surgery and asks for water. What should the nurse do? Option A, explain the restriction and offer mouth care if allowed. Option B, give a small cup because the client is thirsty. Option C, ignore the request. Option D, allow ice chips without checking orders. The correct answer is option A, explain the restriction and offer mouth care if allowed. NPO protects against aspiration during anesthesia. Mouth care respects comfort while keeping the stomach safely empty.